talk about it all the time, getting the guys that we love involved to make sure that they're taking care of themselves. So dads, husbands, grandpas, uncles, and sons, this month is for you.
That's right. And Charlene Shirk is out at the University of Florida Proton Therapy Institute to explain why. Hey, Charlene, what do you got for us?
Well, that is right, because it is Men's Health Month. And you know, real men wear gowns, and here to explain that is the gentleman in the lab coat right now, Dr. Charles Nichols. He's with the UF Department of Radiation Oncology. It's not exactly a gown.
This is a lab coat. This is not a gown.
Not a gown, but what do I mean by real men wear gowns? It's because it's Men's Health Month, and obviously when we talk about men's health, prostate screenings are so important to ensuring that the man you love in your life stays healthy. Let's talk about what some of the current recommendations are in terms of screening. There's been an element of controversy about the optimal timing for screening. The current recommendation from the U.S. Health Preventive Task Force is that a man who has a family history of prostate cancer ought to actually get his first PSA checked at age 40. If there really is not a family history, generally age 50 is the beginning age where PSA screening is recommended. You can talk about, what is PSA? Is that a blood test or a physical exam or a bit of both? The PSA is a blood test. Physical examination is part of the screening process, but generally the PSA is the most robust test we use. And now that's screenings, and obviously that's always proactive. But are there symptoms or things or warning signs that should make men go to the doctor, particularly to get this checked out? Not really. I mean, I think the deal with prostate cancer is that usually it is not, you don't have symptoms of it. And so really to catch it before it causes problems, the PSA screening is the best tool we have. We want to talk about proton therapy here as well, because it's such an effective and efficient way to treat different types of cancers. Can you talk to us a little bit about specifically when treating this type of cancer, prostate cancer? Well, proton therapy is turning out to be a very effective way to treat prostate cancer with curative intent. When we look at our, right now we have about 1,500 patients that we've treated and followed for over 5 years. For low-risk patients with low PSA, low Gleason score, we have a 99% PSA control rate, which I'm going to call a cure rate. Yeah. Intermediate-risk patients, patients with slightly elevated PSAs or higher Gleason scores, 94% PSA control rate. So when we look at those cure rates and compare them to surgical series, X-ray therapy, or radioactive seed implant, we're significantly better than these other modalities. That's what we want to hear. We want to hear a really good cure rate. But one of the things when you mentioned with those other treatments as well are side effects. Sometimes, the cure can be as bad as the disease. So let's talk about proton therapy and the side effects that are associated with it when treating prostate cancer. When we look at this large group of patients we've treated, during treatment, really the only side effect patients will describe is urinating frequently. And I used to think that's because we're irritating the prostate with the proton therapy. I think more realistically, it's we have them drink a lot of water during treatment, and so they have to get rid of it during the day. That symptom really goes away when treatment is done. When we follow the patients, we really do not see urinary incontinence, which is really one of the side effects a lot of men really worry about. It is a common side effect from surgery. It is a common side effect from radioactive seed implant. We really do not see any meaningful urinary incontinence after proton therapy. Well, when we followed patients, over long term, the side effect rate, the meaningful side effect rate, is in the 1% to 3% range. It's really unlikely to see meaningful problems down the road. And so often you get these great results because you do have a lot of clinical trials here and you're constantly doing research. Right. So can you tell us a little bit about if there's somebody out there who may be interested in participating in one of these as it relates to proton therapy and prostate cancer? Well, probably to start out, every patient we treat is followed on a research protocol. There's no one, every patient is part of our study. And so that's why in 10 years here, we have, for prostate cancer, 1,500 patients that we have full 5-year follow-up on.
In total, we have about 4,500 men that we've treated for prostate cancer. We continue to follow them. We don't lose track of them. And so we continuously have data on outcomes. In terms of clinical trials, we've completed clinical trials looking at standard dose radiation regimen, shortened courses of radiation where we give a higher dose per treatment over a shorter period of time. And we continue to develop these trials.
Well, thank you so much, Dr. Nichols, for joining us. We have run out of time, but did you want to get in a quick joke? I know you said you wanted to get in a quick joke.
Nothing that would really go well in this environment.
All right, well, next time, though, okay? You owe me a
Perhaps.
joke. All right, we want to thank UF Health Proton Therapy Institute for sponsoring this segment. And if you'd like more information or if you want to hear a joke from Dr. Nichols, you can visit floridaproton.org or give him a call at 904-588-1436. Back to you guys in the studio.
Charlene, we covered the series.